It's an excellent question. So, before I jump into that answer, I'd kind of say that ideal can certainly be defined in different ways, right? And so
Sure.
I'm going to give you a couple of different sort of examples. I think when you ask who is the ideal candidate for UroLift, I think the most common answer is going to be a younger patient, maybe in their 50s or 60s, and their symptoms have progressed recently in their lifetime. And I'm making up some examples, but their prostate is in a size range that's moderate. So maybe they're 40 grams or 50 grams, and they have no sign of bladder issues as a downstream side effect of their prostate issues. And maybe hypothetically, they tried medications and they responded really well to them. But as I think you've probably spoken about, a lot of the medications around enlarged prostates lead to sexual side effects. And
Yes.
so maybe this ideal candidate got good response to medications, but didn't want to deal with the sexual side effects. And that's, I think, one of the points I'm sure we'll dig deeper into. But UroLift doesn't pose that risk of sexual side effects. So, in my mind, that's an ideal candidate. I think I can get a very good outcome for that patient with UroLift. Um, but I want to answer your question with also a bit more complexity to speak a little bit about some of the other value of UroLift.
Hmm.
So, for instance, let's say that's the almost the most straightforward BPH patient, and we as doctors know you almost never get the most straightforward case, right?
Only the textbooks.
Only in the textbooks. So let me answer your question by going a completely different direction. Let's take a patient who's now in his 80s and he's known for decades he had an enlarged prostate. And he's on two classes of medicines. There's alpha blockers and there's 5-ARIs. And let's say his prostate's pretty large. It's, 80 grams, which is higher in the size range.
Hmm.
UroLift can be an optimal option for that patient too. And I mean that to say, for this patient who's a little bit older, he may not be a good candidate to go to sleep in an operating room. He may be on anticoagulant medications. He may be catheter dependent and you're trying to free him of his catheter. Maybe he's had complications that come from all of these. So, while this is not as medically straightforward of a situation, being able to offer a procedure that doesn't cut away tissue, that can be done in the office, that doesn't require general anesthesia, and where the recovery is days to weeks, that may also be the optimal procedure for this patient, even if I wouldn't define that as the optimal patient, right? I mean, we never get to choose our patients. They come the way they
Sure.
come, and we do our best that we can for them. So, I simply sort of wanted to be illustrative that there's a broad range of people for whom UroLift may be a good option, even if it's not always the most straightforward decision.